Okay, so now we're going to look at where you find these muscles in somebody's body. And if you look down here, these two little dimples, they overlie the posterior superior iliac crest. So the iliac crest begins here, and you can feel as it runs along. I'm going to draw it, and it comes round like that. And what we're going to draw is the posterior spine. So here is the sacrum, carries on down like that, and then you can feel the little posterior spines as they come up. And here. So that would be L5, 4, 3, 2, and upwards. The Erector Spinae sit close to the posterior spines, and they make up this mass of muscle. So the Erector Spinae in this case are the multifidi, the deepest, the semispinalis, and the longissimus, which arises from here and runs more vertically up the spine. Iliocostalis arise from here, and they run up the spine like that, and they give little branches to the ribs. So here's the 12th rib here, there's the 12th rib, and the iliocostalis arises from here, runs up like that, and then will give a little branch to here, to the next rib, and so the muscle's running along like that, slightly away from the first mass, the large mass of muscle, which is the original Erector Spinae. When you get triggers in the Erector Spinae, they tend to be local. And so your pain will be just where the trigger occurs and may refer slightly laterally, like this, but not a long way. And there are some oddities that occur with the especially the iliocostalis, where you may have triggers in the lowest iliocostalis, so that's where the 12th, 11th, and 10th ribs are, and they can be perceived down here, and the iliocostalis at the top will, if they're in the upper thoracic area, will refer up into the neck. But otherwise, the large mass of triggers in the Erector Spinae are local and refer only slightly out to the side, which gives you an idea. So somebody who is very uncomfortable, and you then and they're pointing at a localized area, you're quite confident. You can be quite confident that and it's close to the spine, arising in here. You'll be quite confident that there will be trigger points in the Erector Spinae muscles. So the way you find the triggers, now this is tricky, because normally the principle is that you say you have a longitudinal muscle, you run across the long axis of the fibers to feel for a tight band, and then you move up and down the tight band until you find the trigger. So for iliocostalis out here, that's what you can do. You can run like this. You feel that there's you'll feel it, and you'll feel it like a little guitar string. You find it, and then you move up and down, and the person will say, that's, and you'll feel a little swelling. Once you find the swelling, you can treat it. As you come down here, then it becomes a little bit more tricky, because the fibers, the deep fibers, are running almost that direction. The more superficial fibers are running like that. So my practice is that what I do is I kind of move in an arc, running across what would be horizontal, more 45 degrees, and vertical. I'm running in an arc like this, feeling for a band. Once I feel the band, and it may be difficult with the deep muscle because it's quite small, and I can feel a thickening, then I focus in. So let's just talk about how to treat the trigger. And the way you treat the trigger is using, there are a number of options, but the simplest is to use the ischemic pressure principle. So you find the trigger, and if you've got somebody with a very big, very strong back, you may need your thumb, or you could use your finger. I always help one finger with the other and may use both hands, but this finger is doing the work. I find the point, I press hard enough, I ask my patient, is that the sore point? He'll say yes or no. Once I've found it, I reduce the pressure enough so that there is no pain, but I can still, with a little bit of movement, if I press in, it'll be uncomfortable, and I also feel the nodule under my finger. Once I get the pressure just right, he's comfortable, then we both just breathe and relax and breathe and relax, and gradually I increase the pressure and I say, tell me if it hurts. And usually over 90 seconds, the nodule melts away, he has no pain, I'm able to push hard as I like, and then it's gone. So that's treating the triggers of multifidi, semispinalis, longissimus, and iliocostalis. All of these you can treat in the same way.